Got it.
Can you guys hear me clear?
Yes, ma'am.
Yes, we can hear you.
Yes.
Yeah, we can.
Yeah.
Perfect. This should be team 3. Is that correct?
Yep.
All right. This should be
Yep.
team 3. And this morning, we are going to talk about the lectures that we have assigned this morning are just a couple of small lectures, but they're very, very important. The good thing about it now is that you guys are heading to information for exam 4. And so most of the information that you've already received here in level 1 is information that is critical and more dealing with assessment and your medication administration with Ms. Deek and Ms. Cook. And those things are all things that you needed to help to prepare you for clinicals. And so you got those things early on. You also spoke with me early on some legal ramifications of nursing. And so now today is just a wind down. We're going to start off by talking about professional behaviors, and then we'll talk about some healthcare policies and health and wellness, and wrap up our morning. The content is very simple. Some of it is self-explanatory, but it's also very important in order that we remain in compliance with our nursing licensure and nursing career. Again, we're happy that you're here. We're happy that you've chosen nursing, and you're well off into the semester, and you should know some of these things. And so some of this will be a review for you. Again, all of my questions that I have on the test, I do talk about it in lectures. So if you pay attention and listen, you would have all of that information that you need. Any questions before we begin? All right, so let's talk about professional behaviors in nursing today. Let's talk about, in order to be professional, we must first understand our profession. And so a profession is, it can be defined as an occupation, and it requires extensive education or calling that requires special knowledge, skills, and preparation. So a profession here that we're talking about is nursing, but other professions include law enforcement, attorneys, and physical therapists, medical physicians. And so we're going to refer to all of those different things are just different professions, and they all have a different professional character, a different professional spirit, or a different professional method. And so each profession is defined by its own professional character and spirit. And so nursing as a profession is defined as a profession as well. And nurses are characterized by who they are. Sometimes even when you first got into nursing school and you told your family, I'm in nursing school. And so they looked and they're like, nursing is a very prestigious profession. And so with that, there are different things that we have to do, different nursing professionalisms that we owe. All the influence of the nursing professionalism, we owe that to Ms. Florence Nightingale. And so we have to keep those standards up as we're entering our career in nursing. We have to keep those things going. And some characteristics of a profession, most professions, such as nursing, it requires prolonged and specialized training, in which we know that's why we're here. It requires body knowledge pertinent to the role that is going to be performed. It requires that we provide a specific service. And with most professions, as with nursing as well, it is ongoing research. So the research never stops. I always say that healthcare is ever evolving and things always are changing. And so that's why it's important that ongoing research and knowledge and evidence-based research is all important. Also, it requires a code of ethics. It has autonomy, and there's professional organizations with behaviors based on a clear set of norms. So these are just some characteristics of a profession. Not just nursing, every profession has specialized training and different code of conducts, and some things that are a code of conduct for nursing may not be the same code of conduct maybe for an attorney or maybe for a teacher or some other professions. So Gallup's annual survey of professions released on December 6th of 2020 that 80% of Americans called nurses are honest and ethical and have very, very high standards. So that's huge, right? So 80% of Americans, that is a mass majority of the population. This survey that they sent out surveys to people all over America, all over the United States. And of 180 of those 100 persons said that if this person is a nurse, that this person is honest, that this person is ethical, and that this person has either high or very, very high standards. And that's pretty prestigious, isn't it? I think that's a pretty big number that said that nurses are ethical and nurses are held to a high standard. And so that's why we're here, because we want to keep our profession as high, with high standards. We want to keep our profession thriving. We want to continue, we want nursing to continue to prevail, because right now 80% of Americans say that we're honest, that we're ethical, and that we have very high standards just because we've chosen nursing as a profession. So in pre-conference, Natalie's instructor asked her if she thinks that nursing is a profession. And Maria responds that she does. What are some characteristics that identify nursing as a profession? And we'll select all that apply. So these are some characteristics that will identify nursing as a profession. Nurses provide a specific care. Is that true or false? Nurses require an extended education. Is that true or false?
True.
Nursing has a code of ethics for practice. Is that true or false?
True.
True.
Nursing has a theoretical body of knowledge. Is that true or false?
True.
Nurses have autonomy in decision-making in practice. Is that true or false?
True.
True. So as a nurse, these are some things that we would say define our characteristics of profession. And so I know you've learned by now that if you take those, everybody, even I've sat in your seat and I've been a student at Charity School of Nursing. And so I've got to my test and I saw the select all that apply. And all I did was converted it into a true or false. And then when I finished, everything that was true is what I selected and everything that was false is what I didn't select. And I'm sure you've learned how to work those problems by now, but that is an example of one. And it identifies nursing as a profession. Any questions about that? So let's talk about, we talked about a profession. We talked about what nurses, what the community, what the world thinks about nurses. So let's talk about some of the characteristics that we pose as a nurse that make a professional nurse. Let's talk about some of the characteristics that we have that make these persons feel that we are so prestigious and that we have so many high standards. And so we have professional behaviors. That means that we adhere to our dress codes. That means that we maintain a calm demeanor. That means that we act professional at all times. We have teaching and learning. That means that we participate in our on-the-job training and formal education. That means that we're competent, which means that we accept the standards of care and we practice with evidence-based practice. We collaborate and work respectfully and in conjunction with other healthcare team members. Some other characteristics of a professional nurse is that we are advocates for our patients' safety, which helps us to improve our patient outcomes. And we also have caring interventions, which means that we demonstrate positive attitudes when we're caring for our patients. We demonstrate compassion and awareness, and we're ethical. We adhere to our accepted nursing standards, and we consider them and we carry them out. We implicate them in our actions. So as a professional nurse, these are just some of the characteristics that we pose. And these are characteristics that are professional and that exemplify professional behaviors in our role of nursing. So let's talk about some things that are not so professional. Some unprofessional behaviors of nursing. When we belittle or use bad language with our patients or patient's family, those things are unprofessional. When we deliver negative or despairing nonverbal messages, that means that even if we didn't say it, if we act like it and we looked like it, then that's unprofessional as well. If we engage in constant criticism, that's very unprofessional. If we undermine someone's activities, undermining someone's authority, then that's all unprofessional. If we have emotional outbursts, then that's unprofessional. Those are all unprofessional behaviors. When we're reluctant to participate and answer questions, to give positive feedback, then that can be looked at as unprofessional. And also when we pit staff against other staff, then that can also be unprofessional behavior. And so these are just some things that we don't want to exemplify as nurses, because if we did, then 80% of Americans would not think that we have high standards and that we are, that nursing is a prestigious profession. So some professional roles, all these roles are the professional roles of a professional nurse, and they all center around us being autonomous and being accountable. So we are accountable as nurses, and it centers around us being autonomous and us being accountable. And so some of our professional roles, because as nurses, we wear many hats, and I'm sure you went into your clinical settings already and you've had to go in the room as the nursing student, but when you got there, you ended up being dietary, or you ended up working as a housekeeper and helping to tidy up the room. So as a professional nurse, some of our roles, we wear many hats and we work different roles. And so some of the other professional roles of a nurse, we are caregivers. We're at the bedside taking care of our patients and our patients' families' needs. We're communicators. A lot of times we help the patient communicate not only with their own family, but the other interdisciplinary team members on the healthcare team. Nurses are teachers. We're patient advocates, we're counselors, we're change agents, we're leaders, we're managers, we're case managers. We also help with research and consuming, and we have all kind of expanded career roles that nurses play in different areas of nursing. So these are just some of the professional roles as a nurse that we have. So our nursing practice as defined by the American Nurses Association, or the ANA. So the American Nurses Association defines nursing, okay? And they say that nursing is a protection, a promotion, and an optimization of health and abilities. That nursing is the prevention of illness and injury. That nursing is the alleviation of suffering through the diagnosis and treatment of human response. And that nursing is the advocacy and the care of individuals, families, communities, and populations. And this is what the American Nurses Association defines as nurses. Most nurses and your first probably role as a nurse, and the reason you got into nursing and chose nursing as a profession is probably because you wanted to provide direct care for a patient, that you wanted to care for a patient. But nursing is so much more. It's not just caring for our patients, it's caring for our patient's family, and basically holistically taking care of everything that our patient needs us to care for while they're there with us, as well as advocating for our patients and most oftentimes. So let's talk about the guidelines for attire, demeanor, and electrical media. So these are some things when we talk unprofessional, these are some things that we want to make sure that, because nurses are, the 80% of Americans say that we are prestigious, we have high standards, and that we're honest. And so there are just some guidelines for our attire. There are guidelines for the way we act. There are guidelines for electronic media use and different things that we have. When you put on your Charity School of Nursing uniform, there are guidelines for that attire. That is not attire to go out to a bar and have a drink, because nursing is prestigious, and so many Americans wouldn't think so if they saw all of the nurses out drinking in their nursing uniforms and different things like that. So always be mindful of where you are and the way that you act, your demeanor. As nurses in our clinical setting, we should not have any excessive jewelry, any long fingernails or artificial nails, and no chewing gum. Our hair should be secured and away from our individual receiving our care. We should have personal cleanliness, avoid strong odors and perfumes. We should have clean uniforms or clothing, no body modifications or unusual ear piercing, and no visible tattoos or body parts that are not covered by the scrubs. And so everybody has tattoos and everybody has piercings. And so just when we are in our uniform or when we're in the setting of our patients, that we should not wear those things because it is looked at as unprofessional. And so even if we're not at work yet, or even if we're off and we still have on our uniform, we still represent nursing as a profession. And so that's always important for us to remember. The community, we're caring for the community. And when the community sees us, they feel that if a nurse is not carrying out the responsibility of the uniform, just have pride in your profession, pride in your uniform and everything that you do. And you want to make sure that you follow these guidelines for professionalism. Here are some other guidelines for our nurses that we have to also be mindful of. Avoid loud talking. Loud talking in the hallway, loud talking outside of patients' rooms, loud talking on the elevators in the hospital setting. Look, we're taking care of sick patients. We have concerned family walking through all day, every day. We want to make sure that we provide a peaceful environment, and we want to make sure that we keep a positive environment for our family members and our patients. This helps them to maintain a positive attitude, and it instills hope. So we want to make sure that these settings are as quiet and peaceful as possible. Avoid taking personal phone calls at work. We all have family, we all have kids, we all have other obligations, but make sure that there are designated areas for those phone calls, and make sure that you're not in a patient's area, a patient's family's area, or anything like that when you're taking calls at work. Don't discuss your personal problems with your patients. Your patients are already burdened. And I know sometimes you're there for 12 hours and you're there long days and you feel like you don't have anybody else or anything else to talk to. But one thing we see a lot on surveys when our patients are discharged is that they come back and they say, well, this nurse, and they know all of the nurse's personal information. And so you don't want to discuss your personal problems with patients. Avoid gossiping and bullying of anyone, bullying of coworkers, bullying of patients and patients' families. Those just are not good things to look. You start now building your reputation as a nurse. It already started for you as a nursing student, and your reputation is going to take you a long way. So you want to make sure that you start now and that you don't because once you become a gossiper, you're labeled as a gossiper. And our nursing community is small. And so I know that there's a lot of nurses and a lot of hospitals, but our nursing communities are small, and you may be working for one facility now, but the same staff that's at another facility. So you want to make sure that you carry yourself, that you have an excellent reputation in nursing. Your name is going to carry you a long way. Don't complain to patients or patients' families. Don't use illegal substances. Don't use your personal cell phones to document patients' information, and never share patients' information over social media. That is a big, big no-no. So we talked about nursing as a profession, and we talked about what's professional and what's unprofessional. So as a nurse, what do? What is it that we do? We respond to the needs of our patients. We respond and adapt to challenges. We make clinical judgments and decisions about our patients' health care based on the knowledge, experience, and standards of care. We actively participate in policy, and the ANA actively involved in shaping public policy at a national level. So the American Nurses Association is actively involved in shaping public policy at a national level, and they basically govern nursing. And the American Nurses Association is very big on education, and you'll hear that over and over again. And if you see it over and over again, the American Nurses Association is very big on education every time. So let's talk about integrity. When you talk about nursing and nursing profession, the first thing that comes to mind with 80% of the United States of America's population is that nurses have high standards, that nurses are honest. And so according to Pearson, integrity is adherence to a strict moral or ethical code. So nurses are have high integrity, have high standards. And according to Pearson, that means that we adhere to strict moral or ethical codes. That means that we follow the guidelines that are there for nursing. That means that we do what's right, even when it's difficult. That we do what's right, even when no one is looking. That we do what's right, and it doesn't matter who's doing wrong. Integrity means that as a nurse, we're doing the right thing for our patients. Does anyone have any questions about that? So what does it take? We talked about the profession of nursing, professionalism, some unprofessional behaviors, what we do as a nurse. So what does it take to become a nurse? And that's why we're all here. So let's talk a little bit about some of our nursing. Oh, Rebecca, can you please mute? So some of the things that we do for nursing education. What does it take for us to become a nurse? And so the professional registered nurse education, the first entry into nursing was diploma programs. However, they don't exist anymore. But those diploma programs, at least not here in Louisiana, I don't think they exist anywhere. But diploma program nurses were back in years before our time, when Charity Hospital had nurses, and Touro Hospital had a nursing diploma program. And so those people started working there under the physicians and caring for the patients, and basically got on the job training, or just were kind of granted through the Charity system and the Touro system. And they became registered nurses because they graduated from that program and they received a diploma that said that they are a registered nurse. So those programs really don't exist anymore. So entry into the nursing field is at the associate degree level, which is a 2-year associate degree program. And that is what we have here at Charity School of Nursing. And so once you enter that 2-year associate degree program and complete your licensure, you are a registered nurse. And then there are the 4-year baccalaureate programs, which are the BSN programs. And so basically the difference between the 2-year program and the 4-year program is that the 4-year program, the 2-year program is more clinical. The 4-year program also has research and different avenues for more managerial positions, and basically more theory and different things like that. So for example, I graduated from Charity School of Nursing, just like you guys will. And so when I finished that program, I finished and I was a registered nurse with an associate's degree. And at the same time, I had a family member who graduated a different program. And I won't say the name of the program. However, it's a 4-year BSN program. And so we graduated together, we took our NCLEX together, and we were both registered nurses. Now, when we started working, we got a job together and we worked on the same floor at the same hospital. But I finished my 2-year associate degree program at Charity, and she finished her 4-year BSN program. And so when we got on the floor and we started working together, she kept calling me to her rooms. Can you come? I've never given an injection. I've never done this. So our 2-year programs, basically, we had more clinical time. And then the BSN programs were more classroom and theory and research and different things like that. Not saying that they weren't prepared, but if a lot of times I get questions, and so doing these lectures via Zoom, just a little, it's not as involved, but I get a lot of questions about the difference between the 2-year AD program and the 4-year BSN program. And basically the difference is clinical experience. And so in the 2-year programs, we're in clinical from level 1. And so in the 4-year programs, you may not see clinical until a little bit at the last level, and you may not get as much hands-on experience, but those programs are, that's the difference. Now, the thing is, when you finish your program, whether it's a 2-year program or a 4-year program, you're a registered nurse. And so when you get on the floor, you're a registered nurse. It doesn't say that you're a registered nurse AD, a registered nurse BSN, and some hospitals have now started to differentiate the pay just a little bit. But when I finished, we all got the same. We all were new grads. We all got the same pay. And so the only difference was a nurse was an associate degree nurse and a bachelor's degree nurse. Now, the Institute of Medicine is recommending that 80% of nurses be prepared with a BSN by 2025. What does that mean for you guys? That means that you are basically in the perfect position, because that means that you guys will be able to continue your education and to make sure that you get, continue your education toward your BSN. However, once you successfully complete your licensure or your NCLEX RN, you don't have to take that test again. Once you're an RN, you're an RN. And so you can go to a 2-year program, become an RN, successfully complete your licensure program, and go back and continue your education for a BSN, and you do not have to sit for another NCLEX. Once you are successful at the NCLEX RN, you never have to take that exam again. That's a praise moment. Yay, everybody. So basically, those are the differences between your professional registered nursing program, your 2-year and your 4-year program. Does anybody have any questions before we move to the graduate level? Perfect. We'll go to the graduate nursing education. And so once you complete your associate degree and your bachelor's degree, you can continue your nursing education to your Master's of Science in Nursing. This is the first graduate level nursing education course. And then with the Master's of Science in Nursing, you will become advanced practice registered nurses, or APRNs. And so under the graduate nursing education under MSN, or our family nurse practitioners, or FNPs, or nurse practitioners, there's acute care nurse practitioners, family nurse practitioners care for patients from birth to geriatric. And then there's adult nurse practitioners that are only caring for adult patients. And there's critical care nurse practitioners that only care for critical care patients. So there's a different range of nurse practitioners as well. But family are the nurse practitioners who can care from anybody, from a patient from newborn all the way to geriatric. And then there are also your neonatal nurse practitioners, which care for those patients. And under your MSN is also your CRNAs, or your certified registered nurse anesthetists. And these are the registered nurses that work with the anesthesia doctors and basically work in the OR and surgeries and procedures and assist anesthesia. And then you have your doctoral degrees or your DNPs in nursing, and also PhDs are graduate nursing education levels, which are more theory as well. Does anyone have any questions about graduate nursing education? Any questions about that? Clear. Any questions about that?
I have a question, Mr. Chairs.
Okay.
I did look something up about the RN to MSN program.
Uh-huh.
You obtain you do obtain the bachelor's at the same time for those programs, right? So you're working on
So
your
here it
bachelor's.
is. So I'll tell you how it happens. Now, once you become an RN in the first column, you take your NCLEX and you're an RN, right? But then when you go on to graduate school for your nurse practitioner, you'll have to take another licensure exam. And for your CRNA, you'll have to take another licensure exam. However, when I graduated from Charity and I started as an LPN, I started in the LPN program, and then I did the LPN to RN transitions. And so when I finished my RN, I had an associate's degree, right? And so when I finished that, I was an RN already because I needed to work, right? So I worked as an RN, and while I worked, I never went back to class again until I went to graduate school in clinical for nurse practitioner. I went as an RN, I finished, I did my associate's degree, and then I worked as an RN, and a group of us on the floor went back and we took online classes at William Carey, and we completed our bachelor's of science. And so when I finished and I got my bachelor's degree, it was basically for myself because I worked in the clinical roles, and if I wanted to be a case manager, they were looking for me to have that bachelor's degree. And if I want to become a manager over the unit, then I needed that bachelor's degree because they would look for that education, that theory, and that extra education. So I went and I did that. And so then after I got my bachelor's degree, then I went back and got into an MSN program. And so the MSN program is where I completed when you get into the master's level, the graduate level, there'll be different areas that you choose. You'll start your master's degree program, and then it's going to get to a point where you have to choose, am I taking just the master's in education track and nursing education track? Am I taking the family nurse practitioner track? Am I taking the registered nurse anesthetist track? And then you'll kind of define yourself there. And then whatever track you take, you'll have to finish that exam for that track. Does that help you?
Yeah. So is there a difference? Because I know a lot of programs, they do just the
Anna?
from RN. Yes.
Can I add something here? I know
Yes,
that
ma'am.
when I came in with my master's degree and I wanted to go get my nurse practitioner, some of the programs expect you to repeat your master's through their program. And so you need to find
Okay.
out who it, I think that's the question she's asking. Some
Okay,
of them
all
want
right.
you to repeat it, and some of them want you to can accept what you've already gotten from your school.
Okay, thank you.
Does that help clear it up?
Yes, ma'am.
Okay. And then continuing and in-service education, nurses are responsible for obtaining and maintaining specific knowledge and skills because healthcare is ever evolving and things continue to change. And so we have to go back. Just because we finish school, it doesn't mean that we're done. We are required annually, twice a year, once a year, we are required to make sure that we have competencies to continue our licensure, to renew our licensure. So once you finish nursing, we're always learning. We never stop learning. You're in school now, and you're going to be in school, and you're going to continue your education throughout your career because healthcare is ever evolving and things are always changing, and there's new disease processes and new things come up. And so there's always something else that we're learning in nursing. So we are long-term educators. We are professional students, like my husband says. It's like y'all never finish school. So we're professional students as well. Does anyone have any questions about nursing education? Perfect. So let's talk about some of the professional nursing organizations, because there are nursing organizations that are specified for the nursing profession, and each organization is an opportunity for nurses and advancement. These professional nursing organizations basically define the standards of practice and professional behaviors, and they support our nursing research, and they participate in our policy developments. So these organizations all help to define nursing and keep our profession advanced. So some of the professional nursing organizations is the American Nurses Association, or the ANA, which is very big on education. The National League for Nursing, or the NLN. The International Council of Nursing, or the ICN. And these basically promote national associations. The National Student Nurses Association, in which everyone on this Zoom call should be a member of the National Student Nurses Association, because you are student nurses. And if you are not, take the opportunity to go and look up the National Student Nurses Association, see what it takes to become a member. It's usually something that's free that you can join, but what it will do is it will keep you abreast on what's going on in your profession. It will keep you abreast as to what's going on with student nurses, and there's also scholarship and grant opportunities there. So you want to make sure that you're always engaged and that you're always involved in what's going on in your profession. So look at the National Student Nurses Association. There's also CASN, or the Charity Association of Student Nurses. There's Sigma Theta Phi International Honor Society. And there are other professional organizations that focus on specific areas. So if you are a pediatric nurse, then there are pediatric organizations. And if you are a intensive care nurse, then there are intensive care organizations. So those are just some different organizations for professional nurses that help us to keep up our nursing as a profession. And so then there are certification programs, certifications by specialties. And so once we become a registered nurse, the certification by specialty requirements are individualized, and they are set by each professional organization. So geriatric nursing sets their own guidelines, and it says that that you are a geriatric nurse and a pediatric nurse, that there are certain intensive care nurses, there are certain courses and certifications that you can get to become a specialized a CCRN, or a critical care nurse. So once you graduate as a nurse and you define your profession, if you define an area that you know that you want to, that this is, I love mother baby and this is what I'm doing, then of course you're going to dive into that field. Or if you like mental health, then you're going to become specialized in mental health. And so every specialty has their own certification. And so basically that will just allow you to have the advantages there, just so that you're always abreast on what's going on in your field. And then there's nursing is so widespread. There are so many different things and so many opportunities that you'll have. So make sure that these are just things that you dive into as a nurse. So let's talk about our scope and standards of practice. And we talked a little bit about this in our legal lecture, but our scope of practice varies from state to state. You must know where you are, where you're practicing, and what you can and cannot do. It is different everywhere. What I can do in Louisiana as a nurse, when I travel to Texas, I can do so much more. What I can do here in Louisiana as a nurse, when I travel to Mississippi, I can do so much less. So understand your scope of practice and understand what it takes for you to be a nurse where you are. It's your responsibility to know where you are, to know your standards of practice, and to know what you can and cannot do. You are responsible for your nursing license. Does anyone have any questions about that?
I have a quick question. I tried to look on the Louisiana state, whatever it is, to see what the scope, is, but it's not specific. So
go to the Louisiana State Board of Nursing Nurse Practice Act.
Okay, thank you. Because
guidelines will be laid out.
And it literally tells you a nurse can run this, blah, blah, blah. A nurse.
So basically it gives you your scope of practice. It tells you everything that you can do under what nursing profession you pick, okay? And then, so once it gives you all of those guidelines, then those are your guidelines under the Nurse Practice Act. That means that is what you're governed by your licensure board is the Louisiana State Board of Nursing. So that means I have to follow their guidelines. When I get on the floor at a hospital, I still have to work within those guidelines. Now, the hospital can say, you can't do that here, and that's fine, but they cannot say that I can do more than my scope of practice deems under my licensure board. Does that
But
make
it'll
sense?
say something like a nurse can run a central line, like specific or not, like that specific or no?
It's not that specific, but
Okay.
there are indications saying what you must be certified in and what you must have and which lines and different things like that. And those more specific things are going to be geared toward your facility that you're practicing.
Okay, thank
Okay, okay. So the scope of practice, like we were talking about in the Nurse Practice Act, it varies from state to state. It defines what you can and cannot do as a nurse, and it also defines, it's also the same guidelines and defines what advanced practice nurses can and cannot do. And then, of course, there is your licensure or NCLEX exam, which doesn't change. It's the same in all 50 states. There's no way around it. Every state requires that you successfully pass an NCLEX exam in order to be licensed as a registered nurse. So there's no way around it. You will have to take an NCLEX in order to be licensed as a registered nurse. So quality and safety education for nurses. There are 6 competencies: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. It addresses the challenge to prepare nurses with competencies to continuously improve the quality of care in their work environment. So that means that these 6 competencies help us to improve our quality of care in our work environments that we're providing to our patients. It helps us to identify inappropriate safety measures and correct them. And it basically makes sure that our care is all centered around our patients. And there are always competencies that'll come up with quality and safety education for nurses. And so for each competency, there are targeted knowledge, skills, and attitudes. And these knowledge, skills, and attitudes are elements that are integrated in a nursing pre-licensure program. So here we are again with the ANA, the American Nurses Association. The standards of nursing practice provide the guidelines for implementing and evaluating nursing care. And there are 6 standards of practice which govern how we care for our patient. Our American Nurses Association is high on education, continuing education, making sure that you're abreast to what's going on right now in nursing. And so the 6 standards of practice are assessment, diagnoses, outcome identification, planning, implementation, and evaluation. And these 6 standards of practice are also known as the nursing process. Standards of practice, there are 10 standards of practice that governs the behavior and holds us accountable as nurses. Accountability as a nurse is very big, and it's very major. We will be held accountable. We're professional. 80% of the United States of America feel that we are prestigious, that we have high integrity, that we have high standards. Nursing is a very prestigious profession, and so we want to keep it that way. And so our 10 standards of practice, there's ethics, education, evidence-based practice, and research, which means that everything changes every day. Healthcare is ever evolving, and it's always changing. And what we did 2 weeks ago, we might not do next week. And what we did last semester, we might not do this semester, because things change so rapidly in nursing. And that's why it's important that we continue our education, that we go to in-services on our floors, that we go to in-services in our hospitals, that we continue our education and get our CE requirements required to renew our licensure, because we are practicing off evidence-based practice and research. Quality of practice is another standard of practice. Communication is always important. Leadership, collaboration, professional practice and evaluation, resource, and of course, our environmental needs. These are all our standards of practice. So let's talk about some things that when we talk about professional behaviors and professionalism, we have to talk about it. And I know we went a little bit in legal, but the Institute of Medicine, and these are reports from the Institute of Medicine, they say the number of people who die each year from medical errors is equivalent to 3 jumbo jet crashes every 2 days. So every 2 days, that's like medical errors. Medical errors are errors that we made, that we made as human. They're human errors, but they're medical errors. That's why it's very, very important when we're talking medication administration, when we're doing all these different things. Medical errors are by the Institute of Medicine. It's very, very important that we eliminate medical errors to protect ourselves, to protect our nursing profession. So the Institute of Medicine, I dug a little bit into their reports, and they said, we call medication errors never events. That means that they are events that should have never, ever happened, right? And so 44,000 to 98,000 annual deaths occur as a result of an error. That's a lot of people. Agree? 44,000 to 98,000 annual deaths occur as a result of an error that we made as a nurse. Medical errors are the leading cause of death, followed by surgical mistakes and complications. More Americans die from medical errors than from breast cancer, AIDS, or car accidents. 7% of hospital patients experience a serious medication error. That means if there's 100 people in the hospital right now, that 7 of those persons are going to experience a serious medication error. That's huge. So the cost, because everything rolls down to the cost, right? We're looking at how many lives, right, that happened because of an error. But the cost associated with medical errors is $8 to $29 billion a year. That's massive. And I don't know how many of you are entwined into what's going on now today, but because we are making medication errors, we are losing our license. We are basically losing our lives because they are prosecuting, and it's very, very important that you stop, that you take a minute and make sure that there are safety measures in place. If it says to scan your patient first, scan your patient first. If it says to scan your medication next, scan your medication next. And if the computer gives you an error, stop. It does not matter what else is going on. It is very important that we prevent never events. Does anyone have any questions about that? So never events, they kept happening and they kept happening. And so back in 2005, Congress passed a law and said that CMS, or the Centers for Medicare and Medicaid Services, are going to reduce, withhold, or refuse to reimburse hospitals for certain medical events, and they must report these events to the community, right? So what happened? People started making medication errors, right? People started dying with medication errors, and it just kept happening and happening and happening, and nothing was going on. And so in 2005, Congress said, wait a minute, this is happening too often. We are not going to pay you. Can you imagine working a 12-hour shift, and at the end of your shift, your manager says, you're not going to get paid for today, honey, because this happened and you didn't make sure the bed was in a low position. That's not good, is it? So Congress passed a law and said, we're not going to pay. And so what happens if the hospital doesn't get paid? So never events have become more and more since Congress passed this law. There are now laws, and if these events happen, we are being prosecuted. So make sure that you stop and you make sure that you take all precautions there. So let's stop and think. The nurse on the third shift missed the last chance for the unit competency, stating, "Oh, well, it's not like I don't know what I'm doing." What is the most accurate description of this nurse's behavior? She's arrogant, which keeps the nurse from developing from an accurate assessment of her strengths and weaknesses. She's permissive, which endangers the nurse's profession. She's optimistic, which means that she helps the nurse realize that things will turn out for the best. Or she's sarcastic, which threatens the nurse's job performance.
It's A.
Hey, she's pretty arrogant, right? Nobody knows everything. None of us. We're all learning. Not the doctors, not the nurses. Nobody knows everything. Healthcare is ever evolving. Research is ongoing. There is no one who knows everything. Stop and think. If you miss a unit competency, it is your responsibility to make sure that you get the information needed for that competency. It is your responsibility to know how to take care of your patients. It is your obligation as a nurse. The curriculum for nursing education is strongly influenced by which of the following? Select all that apply. Does physician groups influence our education as a nurse? Absolutely not. The physicians don't get to say what we do as a nurse. They don't have any influence over our education. Does the professional nursing organizations?
Yeah.
Does the individual state board of nursing?
Definitely.
Absolutely. What about hospital administrators?
Yeah.
No way. They don't tell us what to do. We're governed by our state board of nursing, not the hospital administrators. They tell us what we can and can't do in their hospital. Is that right?
Yeah.
And then what about the National Council of State Board of Nursing?
Yep.
Yep, they have some governing over us. So professionalism means everything. Make sure everything starts with professionalism, right? Make sure that you love what you do and you're doing what you love. A lot of times it's absolutely, look, we all have to make a living. And nursing is a lucrative profession. But more than that, nursing is a prestigious profession of high integrity. So our demeanor and our representation as a nurse means everything, not only to us, but to the community that we serve. Everything starts with professionalism. If you go into your job, oh, I'm just not for it today, I'm having a bad day, then you're prone to do something that's gonna spiral downhill. Make sure that you're professional at all times. Your career, your nursing licensure depends on it. You have sacrificed so much to be here. You wanna make sure that you take care of that. You could lose it at any given moment. So it's precious to us. These are things that we want to make sure, but professionalism means everything. Make sure you're always professional. And one thing that I like to quote the late great Maya Angelou, she says that I've learned that people will forget what you've told them. They will forget everything that you said, and that people will forget what you did for them, but people will never, ever forget how you made them feel. So always remember why you started this and make a difference in nursing. Does anyone have any questions about professional behaviors? We will stop, take a 10-minute break here, and then we will come back and we will talk about healthcare policies and health and wellness. Let's get finished. Let's talk about healthcare policies. And so This is short and sweet, but it's pertinent information that we'll just need to know when we are maybe case managing and different things like that. And we just basically want to know about our patients' needs, and a lot of times they get into what coverages they have, but we'll talk about what's important for you guys, and we'll highlight on those different things, just so that you are aware of what's going on. So healthcare policies. First thing is, we want to make sure our biggest concern with healthcare policies is to make sure that everyone has access to healthcare. The National Healthcare Disparity Report, Steps to Accessing Healthcare, that came out with Healthy People 2020, mostly was talking about the uninsured, which are persons who have no insurance at all. And then there's the underinsured, which are the persons who have insufficient coverage. And so the main purpose of Healthy People 2020 was to make sure that everyone had access to healthcare, that everyone was able to get healthcare and receive what they need, find providers to whom they could communicate and have trusting relationships. This just meant Healthy People 2020, that everyone would be able to get access to healthcare. It doesn't matter how rich or how poor or how young or how old. The lack of health insurance grew. There were 48.6 million uninsured Americans in 2011. And so we started gearing toward the Healthy People 2020, and then that number decreased to 37 million uninsured Americans in 2015. And so in 2020, there were 28 million that did not have health insurance at any point during that number. And then the percentage of people with health insurance coverage for all of 2020 was 91.4. And so what happened after that 2020 pandemic, we were initially on a downward trend. We went from 48.6 million in 2011 to 37 million in 2015. So Healthy People 2020 was working. And so we had 28 million insured in Healthy People 2020. And what happened in 2020? We had a pandemic. And so our rate, we went back to trending in the opposite way. And so the last report from the National Health Care Disparity said that we have 31.1 million people that still lack insurance. And this survey was from the first 6 months of 2021. So we kind of trended up a little bit. We kind of trended upward a little bit after the pandemic, as you can see. But basically Healthy People 2020 meant that we were going to give everyone access to health care, and we weren't going to discriminate. Doesn't matter who it was, how old or young, rich or poor. So there was a lack of a usual source of care, and then there was medical or health care at home. And then we also had the children and family options. So the home and medical health care was more trusting and communication improved, and it was likely that the patients would experience appropriate high quality care. Whereas with the children and families, it was better served in a usual healthcare source, and those persons were able to seek ongoing relationships with healthcare teams and provide high comfort levels. Healthy People 2020 with the Healthcare Disparity Report, what was noticed that there was uneven distribution of healthcare services, that patients did not always have access to the care that they needed, which resulted in a delay of care. And so what happens when you have a delay of care, you end up paying more. And so if a patient, say for instance, has cancer, and if they're having annual mammograms, that's why some of our health companies and health insurances are so big on us making sure we have annual mammograms and annual health and wellness visits, is because if we catch those disease processes at the earlier stage, our medical insurance and our healthcare providers will not have to pay so much. It costs higher if you catch cancer at a beginning stage than it does if it's already progressed and is at stage 4. There's a higher cost. So there were also uneven distributions. There were geographic populations that were underserved, and there was an increased number of specialized healthcare providers. So that meant that we had to do something to get a hold of our healthcare and our healthcare services that were being rendered. So Healthcare Solutions came, and there came the Affordable Care Act. There was Medicare for older adults. There was the Medicaid for those adults with lower income. There was the CHIP program, or the Children's Health Insurance Program. And in Louisiana, we call it the LACHIP program, which means that every child, it doesn't matter how rich they are, how poor they are, who they are, that every child in Louisiana has the right to have healthcare insurance. And so that program is still here in Louisiana today, and it makes sure that all of our children here in Louisiana are covered with healthcare. And then there's your local health departments, your community health centers, change patient perceptions needs, and there were physician shortages that continued to worsen. So healthcare organizations came about. So they said, okay, you want everybody to have medical care. You want, Megan, I'm sorry, you have a question?
I have a question.
Yes, ma'am.
Did you say it costs the insurance more if they catch a disease at an early stage?
It costs less.
Oh, less. Okay.
Yeah, so look, what happens is you now see that your insurance will pay you $30 if you go and have your own annual mammogram, right? It's a wellness benefit that they pay you because they want to know if you have breast cancer early, right? Because it's going to be cheaper for them to catch it now and treat it now. They may only spend $1 million in healthcare costs if you catch your breast cancer right now. If you catch your cancer at a stage 4 where it's already progressive and it's already spreading, they may have to spend $20 million, right? So I'm going to pay you $30 to go have your annual wellness. And so every year I'm going to pay you $50 to go have your labs done and make sure that you don't have any disease process that we need to treat right now to make sure that we catch. So those wellness benefits are being done right now to make sure that they catch your disease process early because it saves your insurance company on the back end. Does that make sense? Okay, and healthcare organizations. Any other questions? So healthcare organizations were purposely designed and structured in our social system, and they developed for the delivery of our healthcare services by our specialized workforces and defined our communities, populations, and markets. It said who can get care, who's going to pay for the care, who's going to provide the care, and who's going to give the care, and of course, how will that healthcare be paid? So there are now over 500,000 healthcare organizations. Everybody jumped in and said, oh, Healthy People 2020 is looking for people to manage healthcare. And so everybody jumped on board, and now we have 500,000 healthcare organizations. They all have a common purpose, and that is to provide healthcare delivery systems, right? We have Humana, People's Health, United Healthcare, Cigna, Aetna. And so all of them have one common purpose, and that's to provide healthcare delivery services. But they each have their own unique mission, their own financial classification, and their own unique ownership. Some of the healthcare organizations we have to provide Healthy People 2020 and to make sure everyone has access to healthcare is our public health offices. We have physician offices and ambulatory care centers. We also now in our communities here see a lot of urgent care centers. And so these urgent care centers allow us to go in to be treated for our acute illnesses and then to be discharged home. We have occupational health clinics. And so you'll see a lot of your jobs, maybe like your plants and different things like that, or your schools now have their own clinics, and those are occupational health clinics because they want to keep their employees well. Hospitals, we have subacute care facilities and extended long-term care facilities. The extended long-term care facilities are facilities for patients who require long-term antibiotic use or long-term wound care. And so these are just different organizations that were developed to make sure that, hey, nobody can say that they don't have access to healthcare, because healthcare is on your jobs now, and healthcare is in the hospital, and there are urgent care clinics everywhere that you turn, and you have your physician's offices and your public health offices. Some other organizations were our retirement homes and our assisted living facilities. And so what we see now at our retirement homes and our assisted living facilities are They also have programs that have adult daycare centers, which means that I have an elderly parent who lives with me, but I have to work every day. And so I can't leave her home because she wanders off and or turn the stove on. And so there are adult daycare centers, just like there are kids daycare centers. There are adult daycare centers that are geared toward our Alzheimer's patients and for our clients who maybe if you have running and shopping to do and you needed to drop an elderly family member off, then you can do those. There are rehab centers, home health care agencies. There's also hospice and respite services, which are both inpatient and outpatient. Now, our hospice and respite services deal with advanced illness management and end of life. And those are usually patients who have a poor prognosis or 6 months to a year prognosis. And so they qualify for hospice and respite care. And again, these hospice and respite care can be done inpatient. There are inpatient facilities in hospitals. Passages has an inpatient facility outside of a hospital. And then there are also hospice and respite services can be done in home. And then there are also crisis centers. Does anyone have any questions about any of those healthcare organizations? So then there's always regulatory and accrediting agencies, because what happened? Healthcare disparity report said, hey, we have a problem. We need people to have access to care. So everybody jumped in and said, oh, I'll provide insurance. I'll provide insurance. Oh, I'll come up with adult daycare center. I'll do this. But there are always regulatory and accrediting agencies that have to be involved. They function to help the providers and the agencies to operate. And these agencies typically enforce the laws. They're individually regulated by our licensure boards. So there's a regulatory and an accreditation side to each agency. And so the regulatory means that if you want to maybe open an adult daycare center or something like that, you're regulatory, you're doing it to promote safety and quality. It's not a profit, that it's government run, it establishes rules and regulations, and there's mandatory participation. So that means everyone who opens a certain type of facility, it's mandatory that you, under the regulatory, have everything there. However, if you want to go for accreditation, then it is basically voluntary, but reimbursement is contingent upon accreditation. So facilities that are accredited and approved by the state, of course, will be promoted more and will have a better reimbursement than the facilities that are not accredited. So you see some of your hospitals have accreditation come through because those hospitals are labeled as magnet hospitals, and so their reimbursement is higher because they have that accreditation. And then there's the federal, state, and local agencies, the United States Department of Health and Human Services, which there's a Food Administration, or the FDA. There's the Centers for Disease Control, or the CDC. There's a Centers for Medicare and Medicaid, or the CMS, and then there's Occupational Safety and Health Administration, or OSHA. And the state agencies are the Louisiana Department of Health and Human Services, or DHH, and of course, Joint Commission. And if you've ever worked in a hospital or ever been around a hospital, or if you're in the clinical setting and Joint Commission comes through, it is for compliance. Joint Commission is big on compliance with hospitals. Our hospitals here in the New Orleans area are all Joint Commission certified, which means they get higher reimbursement, but Joint Commission is very important for reimbursement with our hospitals. That's Joint Commission, and they are big on compliance. Any questions about healthcare policies?
Yeah, I got a question. So is Healthy People 2020, is that legislation?
It is. It came actually with the Obama administration. And so they started Healthy People 2020, gearing to, the goal was that by 2020, so many people would have access to healthcare, and so many people would be able to, we would kind of reduce the need for so many, kind of share the healthcare costs, and make sure that everyone what happened, we found out that so many Americans were uninsured. And so as a part of their Healthy People 2020, and the goal was to have everyone or to increase in Americans who have insurance by 2020. And so they called it Healthy People 2020, gearing up to 2020. And so here we are, and it was actually making good progress. And then we had the pandemic, so we kind of made a downcline. So I'm interested to see how it's going to go after we look at it again.
Cool. And then Joint Commission certification isn't required for the hospital operation, just helps with funding.
It helps with funding, and Joint Commission is big on compliance.
But their certification.
Reimbursement. So if you have two hospitals and one hospital may pay you $500,000, as in one hospital may pay $500,000 for your hospitalization. It may be $500,000 for your hospitalization. If that facility is Joint Commission accredited and approved, then the reimbursement will be higher. You'll get your $500,000, but if it's not a Joint Commission approved facility, they'll only get $350 of that $500,000. So that's why when you see JC and people say Joint Commission's in, every hospital wants compliance, right? Because they want to get the full reimbursement.
Gotcha.
And so Joint Commission comes in on behalf of our patients and on behalf of to make sure that we're providing high quality care and that we're giving our patients what we need to give them. And so the hospital is going to benefit, the patient is going to benefit because we're doing what we say we are supposed to do. We're providing the care that we say that we are supposed to provide, right? So the patient makes out very well. But if the hospital is Joint Commission accredited, then they're going to get reimbursed for the services that they're providing. Whereas if you're at a hospital that's not Joint Commission accredited, you're not going to get your full reimbursement. So what hospital wants to lose their Joint Commission accreditation when they can get the full $500,000 reimbursement as opposed to the $350,000 reimbursement, right? So that's why it's so important when your hospitals are saying, oh, we have Joint Commission in, we have Joint Commission in. And so the nurses are on, and it's like everybody's doing what they're supposed to do all the time because Joint Commission is there and they come through to keep our accreditation. And so our hospitals become magnet status because they're Joint Commission and approved and in compliance with Joint Commission. The main thing for Joint Commission is a compliance.
Gotcha. Thank you so much.
Okay, and then another thing I just wanted to touch on with healthcare policies was basically the HMOs. When they came out with all those organizations, there was an HMO and a PPO. And so a lot of people always have questions about what's the difference in an HMO and a PPO. And so when you think PPO, you think you have a personal choice. So you may get a new job and you may have to fill out for your insurance, right? And so it asks you, do you want the HMO or the PPO? Well, the HMO is going to be a little more cost friendly. It's going to be a little cheaper, right? Because they're going to tell you, say, for example, if I work at Ochsner, they're going to tell you, you have to get all your services through Ochsner. You're going to use Ochsner's HMO, and this is cheaper. If I choose a PPO, which means that I have my own choice of doctors and they're not designated to me, I'm going to pay out of pocket at a higher rate because I'm going outside of my hospital to get, I may work for Ochsner, but I may like the doctor at Turo. And so if I want to use that doctor, then I have to have a PPO, which gives me a personal choice. Does that make sense? So PPOs give you a choice, a personal choice, and an HMO designates who your provider will be. That's the only other thing that came up with those healthcare policies. Questions about that? All right, let's finish off with health and wellness. And basically, this just basically tells us who's healthy and who's not, and that there are different perceptions of health and wellness. There are 4 major concepts of health and wellness. It's the environment, the person, nursing, and health. The person, nursing, health, and the environment. The entire environment, the person itself, the nursing, and health are the 4 major concepts. So health means that there is the presence or absence of disease, and health is an individual perception. It's free from symptoms or disease, and it's staying active and in good mood. And so healthy to you may be healthy to you, and healthy to me may be healthy to me. But everyone has their own perception of health. And so it's just individualized, and there's an individual perception. You may see, just say, for example, there's a 15-year-old kid who has diabetes. He takes his insulin every day. He's still able to participate in soccer activities. Would you see him as healthy? Would somebody see him as a healthy 15-year-old? Some people will, right?
Yes.
Absolutely. And then somebody might say, oh, he's not healthy, he's got diabetes. But there's no right or wrong. It's an individual perception. To me, he's 15, he's got diabetes, he takes his insulin every day, and he's still able to play soccer. I'd say he's pretty healthy. So it's an individual perception of healthy. It just depends, and there's not a right or wrong. So wellness and well-being. Wellness is focused on the attention on the whole of the individual, the self-responsibility, the growing process, and the decision-making. And so the opposite of health and wellness is illness and disease. And so illness is a highly personal state in which the individual's physical or emotional, intellectual, social, or developmental spiritual function is diminished. And illness can be anything that's symptom related. Maybe if you feel uncomfortable or something like that, then those are illnesses. And actually disease is any alteration in the body function that provides the capabilities or shortens the normal lifespan. And so disease mainly affects the individual's physical condition or other disease processes. It can be a form of infection, inflammation, or something different like that. And then there's illness behaviors. And so there are 5 different stages of illness behaviors. The first stage is the symptom experiences, the assumption of the sick role. Stage 3 is medical care and contact. Stage 4 is the dependent client role, and stage 5 is the recovery or rehab role. And so what happens is that when we become ill, we go through these different stages. So maybe even with a common cold, the first stage is I got a little runny nose, I'm experiencing symptoms. And so secondly, I say, okay, I'm not feeling well, I assume the sick role. And then the third is that I go out and I seek medical care. And at that point, I'm the dependent client. And then stage 5 is always our rehab and recovery. Which of the following is an example of the emotional component of wellness? The patient chooses healthy foods. A new father decides to take parenting classes. A patient expresses frustration with her partner's substance abuse. Or a widow with no family decides to join a bowling league. The emotional component. A patient expresses frustration with her partner's substance abuse. Isn't that pretty emotional? So what happens is that when our family members are ill, it takes a toll on the entire family. A lot of times it's our patient, but their illness and health and wellness affects everyone around them. So in this one, it will be C, a patient expresses frustration with her partner's substance abuse. So he has a substance abuse issue and she's now frustrated. So that plays an emotional component on her wellness. Any questions about that? So healthcare adherence means that we are adhering to providing care. Adherence, we establish why the client is not following the regimen. We demonstrate caring and we encourage healthy behaviors through our positive reinforcement. We establish a therapeutic relationship. As for healthcare adherence, for us as nurses, we are adhering to our healthcare guidelines. Say, for instance, if we have a medication that is due for 9 a.m., if we administer the medication anytime between 8 and 10, we are in adherence to what we're supposed to do with our patient because we've administered our medication within it. Again, Healthy People 2020 started improving the health of Americans, and it presented a comprehensive 10-year agenda with 4 goals. And those goals were, it was a 10-year agenda to say that there's 4 goals: that we attain high quality care, that we live lives free of preventable disease, that we achieve high equity and eliminate disparities, improve our health, that we create social and physical environments that promote good health, and that we promote quality of life, healthy developments, and healthy behaviors. All of our care is patient-centered. Our patients are in control and they're full partners. The care is based on respect for our patients and their preferences and their values and needs. We also consider our patients' cultural preferences, provide pain relief, and involve families in our patients' care. Remember that our care is always patient-centered. Which of the following is least likely to influence a patient's personal identification of health and wellness? The patient's ability to perform his or her usual duties, the cultural traditions the patient uses in everyday life, the availability and accessibility to healthcare services appropriate for the patient, the medical diagnostic terminology used to describe the patient's signs and symptoms. B, the medical diagnostic terminology used to prescribe the patient's signs and symptoms. Least likely to influence a patient's personal definition of health and wellness. A patient with HIV is scheduled to begin several medications to manage their infection. The nurse will need to provide patient education. Which patient characteristics are the most likely to predict patient adherence to the treatment program? Select all that apply. His education level?
Yes.
Yes, absolutely. Trust and relationship with the healthcare provider, will that help?
Yes.
Absolutely. An expectation that the medication will be helpful?
Yes.
Yeah. The ability to take the medication twice daily as opposed to 4 times a day?
Yes.
Absolutely. And the sex of the patient. Does that matter?
No.
It does not. So it's A, B, C, and D. The impact of illness on the patient and the family. Again, when you're sick and when your patients are in the hospital and you walk in the room and you're like, oh my God, the patient's daughter is there, or the patient's spouse is there. Remember that our patients are in the hospital, but it impacts the entire family. It impacts the entire family emotionally. It impacts the entire family holistically. Because a member of the family who is ill may be seriously ill, and that may be the matriarch of the family. That may be the person who cooks at home, and so now we're not eating right. And that may be the person who provides most of the financial support, and so those persons have that stress to worry about. So remember that caring for our patients, it doesn't only affect our patient; it affects the entire family. Basically, this again talks about the impact on the individual, the patient itself. The patient may have lifestyle changes and body images changes, but it also impacts the family. And also families are always concerned about the length of the illness. How long is he going to be in the hospital? How long is he going to not be able to work? So those are things that we take into consideration. Safety is always big. We always want to make sure that we access our 2 patient identifiers. We should be doing that now in our clinical rotations and make sure that we always have safety first, because safety is very important. Always make sure that we are using our teamwork and our collaborations. This helps us to achieve high quality patient outcomes. It helps with effective communication. Make sure that we're communicating with our SBARs, responding to rapid response and team steps. These are all processes to help with teamwork and collaboration. Always remember that Maslow's hierarchy, we started learning this in elementary school, but Maslow's hierarchies of needs remain the same. If a patient is not eating, if they're eating less than 25% of their meals, then that is of high importance based on Maslow's hierarchy of needs. Self-awareness and management is very important. It is important that we do everything that we need to do to take care of ourselves. We cannot pour from an empty cup, which means that if we are not healthy, we cannot take care of our patients. As nurses, we are known to be the worst patients. We are known to be the worst. We are known to be the most non-compliant patients, but remember to take care of yourself. If you can't take care of yourself, you can't take care of your patient. It's important for us to recognize and prevent burnout. 66% of new graduates experience burnout with emotional exhaustion, scientism, and diminished personal efficiencies. What happens is we have not worked for a couple of years because we've dedicated everything to school. And so when we get out of school, we want to work, but we have to step back. Self-care is very important. Our hospitals are going to be short. They're going to be calling us for extra shifts and we want to make the extra money. But if you're tired, that is going to increase your risk of making a never event, a medication error. So make sure that we are conscientious of taking a step back and doing some self-care and making sure that we do not get burned out. They're going to say that the shifts, you're going to always have an opportunity to make more money. There's going to always be an opportunity to work extra, but make sure you're getting the proper rest and taking care of it. We recognize that burnout is detrimental to the nurse, and it's not only detrimental to the nurse, it's also detrimental to our patients. So we develop strategies to overcome burnout, join professional organizations. Those help us to prevent burnout and help us to just kind of bounce some things off of our coworkers. Say no to extra assignments. If you're tired and exhausted, it's going to be there next week. Do it when you're well rested. Help to save yourself, help to save your nursing license. We have to make sure that we exemplify caring. Most often, we have to have caring relationships with our patients. Keeping a close and attentive eye on our situations and our patients all help to identify and exemplify caring to our patients. Some of the minor concepts of caring is professional behaviors, ethics, stress and coping, and cultural diversity. The 6 caring encounters are demonstrated by the 6 C's, and here they are. When you go on your shift and when you're working, you want to make sure that you are always, so that nursing can remain in that 80th percentile to Americans. We want to demonstrate compassion. We want to demonstrate competence. We want to demonstrate confidence. I cannot stress enough in our clinical rotations. You have to be confident in what you do. You have to be sure, you have to be, it's okay to say that I don't know and to leave out and to ask questions and get questions to the answers, but be confident, be conscientious, be committed, and then there's also compartment. Does anyone have any questions?
Yeah, is this defined a little more in the book, like in a little more detail?
It is, yes, it is. And that would be Concepts 2, page 2463 is where you'll find the 6 encounters. The caring encounters are demonstrated by the 6 C's and they'll be listed there. What you need to know is that you need to be adherent to providing our patients care in a timely manner, and that you need to understand the Maslow's hierarchy of needs, that if our patients are not consuming enough of their meals, that nothing else, everything starts with nutrition according to Maslow's hierarchy of needs. Any questions? You guys enjoy the rest of your day. If you need me, feel free to reach out. My email address is jchair@ec.edu. And good luck to you.
Thank you.
Absolutely.